Assalamu alaikum, dear students. I am Dr. Shumaela Kanwal, Associate Professor, Department of Physiology, and I am going to start with a new topic, that is physiology of respiration. It's our first lecture today, so we are going to learn the basic concepts which are related to the physiology of respiration. And by the end of this lecture, you will be able to define respiration. You will also be able to differentiate between the types of respiration, and we will learn the steps of respiration, and then we will understand and learn the physiological anatomy of the respiratory tract. After having learned these basic concepts, we will start with the mechanics. So first we are going to see what is respiration. What does actually respiration mean? Generally, we believe that respiration is the process of breathing, and we inhale and we exhale, so this accomplishes the process of respiration. But in fact, this is not a complete definition or not a complete explanation of the process of respiration. So here we are going to define the process, which includes all the aspects. So respiration, it's a process in which all the events are included which are there in making oxygen available to the tissues, utilizing the oxygen by the tissues to derive energy from the nutrients, and removal of the carbon dioxide from the body, which is produced during the process of utilization of oxygen. So respiration is not just breathing air in and out of the lungs, but it is the supply of oxygen to the each and every cell of the body, and then removal of carbon dioxide, which is produced in the cells, from the cells to the external environment. And all the steps which are involved, all the events which are occurring during this process, or all of them are included in the process of respiration. We take our first breath when we are born. It means that during fetal life, the lungs are non-functional. We are not breathing, the fetus does not breathe through the lungs. In fact, the oxygen is obtained from the maternal blood, and carbon dioxide from the fetal blood is removed via the maternal blood. When the baby is born, the baby takes the first breath, and after that, the process of respiration continues throughout our life. The whole process of respiration can be divided into two steps, or we can say there are two types of respiration: internal respiration and external respiration. So now we are going to see what is the difference between the internal and external respiration. Internal respiration is also known as cellular respiration. It means the intracellular metabolic processes which are carried out within the mitochondria, and in these processes oxygen is utilized and carbon dioxide is produced to derive the energy from the nutrient molecules. So how the nutrients molecules are utilized in the presence of oxygen to produce energy, that process is called as internal respiration. The other process or the other type is external respiration. Now, external respiration is the exchange of oxygen and carbon dioxide between the cells of the body and the external environment. Means making oxygen available to the tissues and removing carbon dioxide from the tissues is external respiration, while utilizing oxygen to obtain energy from the nutrients and production of carbon dioxide during this process is the internal respiration. In this unit, or in the physiology of respiration, we basically will be understanding the process of external respiration. So we will focus our attention on the process of external respiration, while the process of internal respiration you must have studied in detail in biochemistry. So here we are on the steps of external respiration. So by now we have defined the external respiration. Now we are going to see what are the steps by steps, the process of external respiration. Now the first step in the process of external respiration is ventilation. Ventilation, or the gas exchange between the atmosphere and the alveoli. So this point is very important. Ventilation, which is generally called as breathing, it is just the exchange of oxygen and carbon dioxide between the atmosphere and the alveoli. This is the one step of external respiration, or the first step of external respiration. The second step of external respiration is exchange of oxygen and carbon dioxide between the air in the alveoli and the blood in the pulmonary capillaries. So once oxygen is there in the lungs, it will be diffused from the lungs into the blood, and the carbon dioxide which is present in the pulmonary capillaries, it will diffuse from the pulmonary capillaries into the alveolar air. This is the second step of external respiration. Then the third step of external respiration is transport of oxygen and carbon dioxide by the blood between lungs and the tissues. So what does this mean? It means when oxygen it has diffused from the lungs into the blood, it must be transported to each and every cell of the body. And when it is utilized inside the cells, carbon dioxide is produced, and that carbon dioxide it must be transported from the cells to the lungs so that it can be exhaled out. So this is the third step. Oxygen is transported from the lungs to the tissues, and carbon dioxide is transported in the reverse direction, in opposite direction, from the tissues to the lungs so that it can be exhaled out. This is the third step. Next is the fourth step of external respiration. The fourth step of external respiration is the exchange of oxygen and carbon dioxide between the blood in the systemic capillaries and the tissues. So exchange of oxygen and carbon dioxide, here this is the systemic capillary and this is the tissue cell. So exchange of carbon dioxide and oxygen between the cells and the blood is the fourth step of external respiration. And here this is the internal respiration, in which oxygen, in the presence of oxygen, the food is used, it is utilized to produce energy in form of ATP, and during this process carbon dioxide is produced, which is a waste material. It must be removed from the body, so it diffuses out from the cells into the blood. Blood carries it back to the lungs, and from the lungs it is exhaled out. So between atmosphere to the tissues of the body, there are 4 steps involved in the process of external respiration, and we are going to learn the details of all these 4 processes, or the 4 stages of external respiration, one by one. Today our goal is to understand the anatomy of respiratory tract. From this discussion that we have done so far, we can also conclude that respiration is not the function of the respiratory system only, but it also involves the other homeostatic systems of the body. Like we require blood for the transport of the respiratory gases between the lungs and the tissues. When I say respiratory gases, I mean oxygen and carbon dioxide. Similarly, we require an intact and fully functional cardiovascular system to provide a mean for transporting these oxygen and carbon dioxide between lungs and the tissues. Heart must pump the blood into the circulatory system, then circulatory system should be able to carry this oxygenated blood to the tissues, and from the tissues the partially deoxygenated blood which is carrying carbon dioxide must be transported back to the lungs. So different homeostatic systems of the body help the lungs to perform the function of respiration. Another very important point to remember is that respiration is an automatic process. Means it is occurring on its own. It is not under our voluntary control. It is regulated by the control centers which are present in the brain stem. These are called as respiratory control centers. Now, to perform their function, the respiratory control centers receive input from the receptors which are present in different parts of the body. They guide these respiratory control centers to control the function of respiration, which is performed by the lungs. Now coming to the anatomy of the respiratory system. Now the respiratory tract or the respiratory system, it is divided into two main parts or two portions: the upper respiratory tract and the lower respiratory tract. First, we are going to learn about the upper respiratory tract. We are going to see what are the parts which are included in the upper respiratory tract, and then we are going to learn about the lower respiratory tract. So, as I just said, that there are two parts in the respiratory tract, upper and lower. And you can see in this diagram, there are the components in the upper respiratory tract, which include the nasal cavity, pharynx and the larynx. So three components, three parts in the upper respiratory tract. Again, I am repeating: nasal cavity, here it is, this is the nasal cavity, the pharynx and the larynx. While lower respiratory tract is formed by the trachea, the bronchi, these are the two bronchi, main bronchi, and the lungs, in which we have the spongy tissue, connective tissue, as well as we have the airways, and we have the alveoli, and we have the blood vessels and lymphatics as well. So first we are going to start with the upper respiratory tract. As we have just enumerated the components, the nasal cavities, again you can see in a much enlarged view, this is the nasal cavity, the first part. Then we have the pharynx, this entire is the pharynx, and you can see that pharynx has subdivisions. We are going to learn about them. Then from the pharynx below is the larynx. So this is the larynx, and larynx, it will continue into the trachea, which is a part of the lower respiratory tract. Now nasal cavities, they are opened anteriorly. The anterior opening of the nasal cavities is called as anterior nares. So the air, it enters into the respiratory tract through the anterior nares. Now there is an alternate route for the entry of air into the respiratory tract, that is the mouth or the oral cavity. So this is the oral cavity, this is the tongue. So when nasal blockage is there, like when we have flu or common cold, there is congestion in the nose and we are unable to breathe through the nose, we will breathe through the mouth. So oral cavity is not a primary route, but it is an alternate route for the entry of air into the respiratory tract. Now in this part, in this diagram, you can see the inside structure of the nasal cavity. The nasal cavity, its lateral wall, it has folds in it. You can see these are the folds. Now these folds are called as turbinates. These folds are called as turbinate. We have a superior turbinate, we have a middle turbinate, and we have an inferior turbinate. These turbinates or shelf-like projections are present in the bones. So bony projections are these. Now these bony projections are covered by the mucosa, and over the mucosa there is a layer of mucus, because the epithelium of the mucosa is rich in mucus secreting glands. Now what is the purpose of these turbinates? We are shortly going to learn. Now nasal cavity, posteriorly they open into the nasopharynx through the posterior nares. Through posterior nares, the nasal cavities open into the pharynx. Now the pharynx is divided into three parts, as you can also see in this diagram. The part of the pharynx which lies behind the nose is nasopharynx. The part of the pharynx that lies behind the oral cavity is known as the oropharynx, and the part which is behind the larynx or adjacent to the larynx is called as the laryngopharynx. There is one very important thing that you must remember about the pharynx, and that important point is that pharynx, it has a dual function. It has a dual function. It is a pathway for the conduction of air from the nose into the larynx, one function, and the other function of the pharynx is to let the bolus of the food to pass from the oral cavity into the esophagus. तो ये जो tube है, this tube behind the trachea is your esophagus. So pharynx is performing two functions. It is a tube, it's a pathway for the conduction of air from the oral cavity into the larynx, and also a pathway for the passage of food from the oral cavity into the esophagus. But remember that pharynx performs one function at a time. It performs only one function at a time. What does it mean? It means that when we are breathing, the swallowing is inhibited. When we are breathing, we are not swallowing. And when we have to swallow, the breathing is inhibited. So pharynx will perform one function at a time only. So when you are swallowing, your breathing is inhibited and air will not pass through the pharynx. And when you are breathing, you cannot swallow. Now this is basically for the protection of the lower respiratory tract. We can prevent the entry of the food into the lower respiratory tract by this mechanism. Otherwise, there can be entry of the food or the food particles into the larynx, and it can cause choking and respiratory problems. The next part of the upper respiratory tract is the larynx. Now larynx जो है, that is also called as the voice box because of a very important structure which is present in the larynx. These are called as vocal cords. So larynx, the other name for the larynx is voice box because of very important structure known as vocal cord. Now these are the vocal cords you can see in this diagram. The vocal cords are basically the bands or the elastic tissue which is extending from the lateral wall of the larynx. They are extending from the lateral wall of the larynx, and when you are breathing and it is passing through the larynx, this causes vibration of the vocal cords, and this is going to produce sound. So a very important function of vocal cords is to vibrate and to produce sound. Since sound is produced in the larynx, so that's why it is called as voice box. Now the vibration and the movement and the position of the vocal cords is controlled by the contraction of the muscles which are present in the wall of the larynx. Now the opening of the larynx is called as glottis. This is the opening. The opening of the larynx is called as glottis. This opening you can see, and this opening is covered by a lid-like covering which is called as epiglottis. Epiglottis means over the glottis. It's a lid which covers the opening, and this is an additional protective mechanism to prevent the entry of the food into the larynx and into the lower respiratory tract. Now what are the functions of the upper respiratory tract? One very important function of the upper respiratory tract is that it is a pathway, it's a channel through which the air can enter into the lower respiratory tract. In addition, many other important functions are performed by the upper respiratory tract that we are going to learn now. One of very important function is conditioning of inhaled air. Conditioning of inhaled air. Now, what does air conditioning mean? Now, air conditioning, it includes three processes: filtration of air, or we can also say cleansing of air, cleaning the air, humidification of inspired air, and warming of air. Now, these three processes together, they are called as air conditioning functions of upper respiratory tract. Now, we are going to learn these in detail. First is the cleansing function and the filtration of air. Now, cleansing function or filtration of air is a process which is carried out in the upper respiratory tract, as well as this process will continue into the lower respiratory tract. So here I will completely describe this process, that is cleansing of air. Some part of will be the contribution from the upper respiratory tract and rest of will be carried out in the lower respiratory tract. So यहाँ पे I will completely explain it out, and I will tell you कि how much is performed by upper respiratory tract and how much or which function, which air cleansing mechanism is occurring in the lower respiratory tract. So different mechanisms of cleansing of air include the entrapment by the hairs. Turbulent precipitation is another mechanism. Then is the gravitational precipitation, and we have alveolar macrophages to play their role too. So we all know and have observed that we have small hairs at the opening of the nose, or just inside the anterior nares or inside the nostrils. Now, the purpose of these hair is to entrap the dust particles which are present in the air. The dust particles present in the inhaled air, first of all, they are entrapped by the hairs which are present inside the nostrils. Larger dust particles are entrapped here, which usually have a diameter greater than 10 micrometer. Now, the smaller particles cannot be removed, or they cannot be entrapped by the hairs present in the nostrils. So, for the entrapment and for the removal of those particles, we have the other mechanisms like turbulent precipitation, gravitational precipitation, and we have alveolar macrophages to remove very small particles from the inhaled air. Now, the second process of cleansing is turbulent precipitation. Now, what is turbulent precipitation? When I showed you the structure of the nose, I showed you there the shelf-like projections, which were the turbinates. Here again you can see these are the turbinates. Now, these turbinates are they are meant to first of all increase the surface area of the nose. Secondly, these turbinates, they are involved in turbulent precipitation. I told you that these are covered with the mucous membrane, and there is a layer of mucus over these turbinates. So when you inhale the air, it is going to move in different directions inside the nose. Now, the air, when it strikes these turbinates, it is going to change its direction. When you inhale the air, it strikes these turbinates, and after striking, it will change the direction. But the dust particles which are present in the air, they cannot rapidly change their direction, and they are entrapped into the mucus which is covering these turbinates and mucosal surfaces. So the entrapment in such a way, this is called as turbulent precipitation. These turbinates produce turbulence of air because of they form like obstructions, obstacles for the air. So they cause turbulence of air. Each time air will strike them, air is going to change the direction, but the particles, because of their inertia, are unable to do so, and they will continue in the direction, they will hit the surface, and they will be entrapped in the mucus which is lining these surfaces. So this mechanism of cleansing of air is called as turbulent precipitation. I hope you understand this process, and if you have any query in understanding, you can ask me questions after listening to the lecture. Now the particles which are entrapped by turbulent precipitation, they have a diameter from 6 to 10 micrometer. The particles having a size from 6 to 10 micrometer are removed by turbulent precipitation. The next mechanism for cleaning of air is gravitational precipitation. Now gravitational precipitation, it occurs in the bronchioles and small bronchi, so which are the parts of lower respiratory tract. Now in gravitational precipitation, the dust particles are settled into the mucus covering these surfaces of lower respiratory tract like bronchi and bronchioles because of gravity. Since the particles settle down because of gravity, so the process is called as gravitational precipitation. Now the size of particles which settle down by gravitational precipitation is from 1 to 5 micrometer. Now even the small particles having a diameter less than 1 micrometer, they may escape this process and they can reach the alveoli. So the goal of these cleansing function is to clean the air by the time it reaches the alveoli. So most of air is clean, but if very small particles having a size less than 1 micrometer are still present in the air, they are removed by the macrophages which are present in the walls of the alveoli. So alveolar macrophages are going to remove those particles, and in this way the air is cleaned up as it is inhaled. So this is the mechanism of cleansing or filtration of air. The next function of upper respiratory tract is humidification. Humidification means adding water vapors to the dry air. So when we inhale dry air, it is humidified by addition of water while it passes through the upper respiratory tract. Water vapors are added to the air so that the vapor pressure of water increases to 47 millimeter of mercury. Now humidification is very important function, because if the air is not humidified and it remains dry, it can lead to drying and crusting of the epithelium of the airways. So humidification is also done mainly in the upper respiratory tract, the nose, pharynx and the larynx. And again I am repeating that due to humidification, the vapor pressure of water in inhaled air, it is increased to 47 millimeter of mercury. The third process or mechanism of air conditioning is warming of air. Cool inhaled air, it is raised to the body temperature as it passes through the upper respiratory tract. So whatever is the temperature of the atmospheric air, if it is cool, less than body temperature, the temperature of inhaled air will be raised to body temperature, that is 37 degrees centigrade. So this function is also performed in the upper respiratory tract and mainly in the nose. Now this function is made possible because the mucosa of the upper respiratory tract and mainly the mucosa of the nose is extensive and it is vascular. It has a rich blood supply, so that it can warm the air and it can also moisturize the air. Now this was about the air conditioning function of the upper respiratory tract. Now, other functions of the upper respiratory tract are its role in the defense of the body. The secretions which are present in the upper respiratory tract have antibodies, lysozyme, and interferon, and all of you are well familiar with the functions of these substances. So they help us in protecting against different pathogens. And the very important thing to remember is that the epithelia of the respiratory tract are ciliated. Ciliated epithelium is there. Now the cilia of these epithelia, they continuously beat, they continuously move, and the direction of movement of the cilia is towards the oropharynx. The direction of movement of cilia is towards the oropharynx. Now whatever is trapped in the mucus, either in the upper or in the lower respiratory tract, this ciliary movement will cause this mucus to move towards the oropharynx, and in the oropharynx either it will be expectorated or it will be swallowed into the esophagus. So whatever has been trapped in the mucus of the airways will be cleared off, it will be removed from there due to ciliary action because of the cilia present in the epithelium. Now there are other functions as well of the upper respiratory tract. We can say that these are non-respiratory functions, like nose is an organ of smell. In the upper part of the olfactory in the upper part of the nasal cavities, we have olfactory mucosa in which the receptors for the smell are present. So nose is an organ for smell. It has cultural importance. It's a sign of honor for all of us. It has cosmetic importance. Then phonation is an important function of upper respiratory tract. As I have told you in the previous slides, that vocal cords are there in the upper respiratory tract, are the part of larynx which vibrate to produce sound. Production of sound is called as phonation, and conversion of the sound into meaningful words is called as articulation. Articulation is a meaningful speech, a meaningful sound, conversion of sound into words. Phonation is just production of sound. Nose and the paranasal sinuses add resonance to the voice. Paranasal sinuses are air-filled cavities present in the bones of the face, like in maxilla there is maxillary sinus. So these are air-filled cavities. Nose as well as the paranasal sinuses add resonance to the voice. Then nose is also a route for administration of drugs. We can administer drug through the nose, like nasal sprays are there. It's also a route for administration of nasogastric tube, which can be used for feeding purpose. So these are different functions of the upper respiratory tract. I will stop here, and I hope after listening to the lecture you are able to understand the lecture, and if you have any query regarding any point, you are free to ask questions and I'll be there to answer your queries. And we will learn the lower respiratory tract anatomy in the next lecture, inshallah. Allah Hafiz.